Do we really have to do the same thing exactly the same way that they did it? After all, their organization is different than ours, different resources, different structure, different people. Can't we do it our own way? That's a question you're going to have a lot. And after the go, no go decision you make about whether to implement an innovation, new idea, platform, or whatever, then the question is, can we change it? Can we adapt it to our needs? It's a good question. It's the right question. It's the topic of this week's reflection. Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping decision makers and leaders navigate change with clarity. In viral healthcare, we explore the trends spreading across healthcare and how to implement them effectively and sustainably. So today's reflection is a break off of our discussion on this week's episode about fidelity versus adaptation. This idea of there's evidence-based practice, well described in the literature. One or more organizations have implemented this and shown great results, and now it's your turn. You want to try to do it in your organization, and maybe you need to make changes. And which changes are the right ones? So fidelity means you stick it very close to the original method. Adaptation means you're kind of winging it or doing it on your own. And they're both right and wrong. And it's really important to ask the right question. So today I want to talk about a great example. I can't go into enough depth of it as I'd like, because it's this really fantastic example of when and how you need to think about this question of, do I need to do it just the way they did it, or can I make some changes in the way they do it? And that's the ABCDEF bundle. I know it sounds kind of fun, but it relates to patients in the intensive care unit who are on a ventilator, really sick, and how to get them off the ventilator and out of the ICU more quickly. It was later changed to become the ICU Liberation Bundle, because that really is what it's all about. It was developed after years of research on each one of the components of the bundle. A is about assessing and managing pain effectively. B is about this weaning, awakening the patient, spontaneous awakening and spontaneous breathing trials with them. C is about the choice of sedation and analgesia, because some medications have other harmful effects than others. D is about delirium and assessing, preventing, and managing delirium in ICU patients. E is about early mobility, and that's getting people up to walk, even if they're on a ventilator, even if they're really strapped down because of all of the equipment and tubes they have in them. And then F was about family engagement, family empowerment, and this whole participation of increasing the size of the team. The research showed that when you implemented the ABCDEF bundle, tremendous reduction in mortality, like 68% reduction in 7-day mortality, dramatic reduction in delirium, dramatic reduction in patients that were sent home who might have been going to a nursing facility or rehab facility after discharge from a successful course in the ICU. Just incredible improvement. The question started emerging then with each one of those. Yeah, I probably need to do all, or maybe I just do some of them. But it was really obvious early on that they're additive, they're synergistic, they link to each other. So in other words, you have to do a spontaneous awakening, you have to have a good choice of sedation and analgesia, you have to have the right amount of pain management rather than keeping the patient snowed. Otherwise you won't be able to have a breathing trial, you won't be able to get them up and walk. And walking seemed to impact delirium, both in a preventative way and to shorten the course of delirium. So all of the components were interlinked, synergistic, and additive. And yet people still struggled to do all of the components. For example, early mobility. Yeah, you can maybe walk them a few steps, but do they really need to be walking up and down the hall? And what the research suggested after thousands of hospitals had done this is that the more you did, the more of the components that you did within the components, the better the outcome. At Sutter Health, they showed that a 10% increase in compliance with the elements of the bundle had a 7% increase in life expectancy. Dramatic. So then you say, okay, what do we need to do to implement it in our facility? And again, I want to go back to early mobility. It's a great example. Different organizations may use different staff. They may have different protocols or times a day that they need to do early mobility. And early mobility on a sick patient may be different than somebody who's awake, alert, ready to be off the ventilator in the next 12 to 24 hours. So there is local adaptation. There are ways to think about it. The spontaneous awakening and breathing trials, what time of day it needs to be done. Does the respiratory therapist have to do it, or can the nurse do it? Does the physician have to be there? Lots of decisions about implementation, lots of decisions about the how and where, but really the key thing is to get it done and to make it successful. So when you think about, should I adopt it? Should we adapt it, or should we abandon it? That's the AAA question that we talk: adopt, adapt, abandon. The real questions to ask are, what's the purpose, and how will I know whether this segment, this step, this component is successful or not? And when you break it down and ask that question, instead of saying, how can I simplify? How can I do with less? How can I adjust it for my needs? You really ask the question about really what's the purpose and how best can we implement it, and how will we know that we're doing it effectively. This is why measurement of the components oftentimes are as critical as the overall outcome measurements that we're trying to do. So it's a really difficult thing to do. There's some art involved with it. There's understanding the people in your organization, people with more experience doing this adaptation versus fidelity question, and trying to figure out what's the right thing in their organization is an important thing to consider. So if you're thinking about implementing a new innovation, a new idea, I really challenge you to really step back and ask questions about this. How exactly do you need to do it to get the outcomes, the excellence that was published in the literature that other organizations might have achieved? And think about not just simply replicating what they do, but adapting it so that you can do it and spread it and make it happen successfully in your organization. Parts of it are likely to be different than all other organizations, and parts of it likely to be exactly the same. So if you enjoyed this episode, please share it with a friend. If they're implementing an innovation, a new idea, a new platform, a new protocol, a new medication, new technology, let them see it and ask those same questions. I'm Bruce Spurlock, and I'm looking forward to seeing you the next time.